Good afternoon. This is Dr. Wyatt again, and I'm going to discuss a case here that's maybe a little controversial, but I feel that all orthodontic cases should be finished in the retention. Now that may not be possible, but I want to back this statement up at the end of this video. I also, in this particular case, we have several deciduous teeth that we work with also finishing it out. So it might prove interesting how we work that in, and also doing these pulpotomies to make room for the teeth to come in. So let's get started on it, and I'll try not to take any more time than I have to. This young lady has a very straight facial profile, and I haven't been able to fix that up. Maybe if she had some of this material that thickens the lips or something, it might have helped the appearance of it. But very nice young lady, and finished the case out just real, I think, real good. So I want to show it to you. Now, starting out, we have several problems, not anything difficult or anything like that. We're pretty well class 1 relations all the way around. A little class 2-ish over on this side. In fact, it is about a half class 2 on the left side of the mouth here, but that's not a big deal for us. So I'm going to rush on through here. The lateral tooth is out of position, and we've got a lot of deciduous teeth in the mouth when we start, and so we lose them pretty quick, though. This looks like I think this is a bicuspid right here. This is, of course, a deciduous molar, and this was too on this side, and I'm pretty sure that is a deciduous tooth there. So I'd hate to think that I don't know the difference between a deciduous tooth and a permanent one, but here we've got just deciduous second molars, and we wanted to get the bicuspid in there, and we didn't want to take any more room than we had to, so we did a couple of pulpotomies on these molars back here, which you might not want to do, but that kind of allowed us to line the rest of these teeth up right here without expanding them more, and then left plenty of room for our second bicuspids to erupt in there. So here we go. We put double brackets on the anterior teeth. I don't know exactly why we did that, but the rest of them, we have these winged brackets, which are extremely effective in rotating the teeth. They get a little bit of food structure underneath there, and you get some decalcification. But now with excellent sealants and everything, you can seal all the teeth before you put the brackets on the teeth. It helps a lot. Now here we used a step down arch where we're got a deciduous tooth right in this area, and so we just holding that open there for that deciduous tooth. All right, here we've got these two deciduous molars. Now one of them is resorbing away, but it's leaving a portion of the distal root in there, and so I'm sure we had to remove that tooth to clean that thing up. Let's see now. And here we've done the pulpotomies now on these molars, and the bicuspids will come in. The first bile just come in and take up part of that space right there, and that leaves more than enough to get the second bicuspids in the mouth. And they've got their 6-year molars here, and our 12-year molars coming in behind that. So we'll go on through with this. Okay, we've got step down arch over there on that side also, and we're lining all this up, and it's coming in pretty good. The side that was slightly class 2, or it's about a half class 2, we'll be able to pull that back in line, and I'm going to run through it pretty quick here. Up above, we still have 2 deciduous second molars up there, and down below we've lost the one on the right side, but the one on the left side is still in there. So selflumetrically, you look at it, it's a little class 2-ish, not bad. So anyway, that was a very, very small problem that we had here. And we kind of worked with deciduous teeth and finished it out. Now here, the second bicuspids were coming in, but these seem to be absorbing the bone structure around the deciduous teeth pretty slowly, not doing a real bang-up job of resorbing the deciduous teeth. And you can see the 12-year molars here, and here are the wisdom teeth forming at this time. This is 1985, and the wisdom teeth on the bottom are formed. There's the one on the top up here left is forming there, and I see something here. So it looks like she's got all of her wisdom teeth are in the process of developing at this age. I don't have her age down here right now. This is the second video, the second Panorex. And here's something I wanted to point out. We did this pulpotomy, but there's still enamel structure down here at the bottom of this. And this bicuspid is coming in here, but it leaves this portion of this root still there. And that's pretty strong, and that prevents this bicuspid from coming on up. Now on the other side of the mouth, the bicuspid is already in the mouth, you see. So this one is being held up by this. Whenever you see that developing, always get this thing out and then hold the space open, and that's what we're doing here with this step down arch wire, and then get this piece of root out and let this tooth come in. The resorptive cells aren't working full blast. Usually they'll just eat this root away and they'll come on out. So, but that's the reason for the delay of this tooth as compared with the one over here on this side there. So I'll erase that so you can see that root again right there. Whenever you see that, just prepare to do something, because it can hold the tooth in there, and your permanent tooth can't eat the enamel structure away. But that other back part's a root, and it can't eat that. So anyway, we got that out, and the next Panorex was 7 of 86, and here's one 5 of 87, and that tooth is gone, and that bicuspid is in, and this one is in, and everything's lined up in there pretty good. And one tooth I didn't get down in the mouth good right here, and I want to show you that, and then show it to you after it erupted, after we had her in retention. That's what we corrected that with. Now let's go in here. We go in to finish it, in the second part of it, and we put these brackets that have the little wings on them. Wings are excellent for rotation, and now that you've got good sealants, they work real good. So I don't recommend anything, but that is a good thing to use. And now this bicuspid, you see we got the bracket on it too low down, and that's holding the tooth up. But watch this as it finishes. If you finish the case and take it out and put it in retention, and here the same thing. See, the bracket was put on too early, getting too eager to get it in there, and so we put the bracket too much to the tip, so it leaves a gap in here. And I'm going to finish it with that gap because I know what's going to happen right in here. Now these are omegas, which I love using them, and you can take the arch wires in and out. You can move the molar in or out, or however you want to, using those omegas, and you keep the arch wire centered all the time. Now we'll go to the next. Now here it shows those two teeth. I want you to watch. Neither one of them are fitting together like they should. There's nobody, I grant that I could have done this better, bonding that tooth better, but God hadn't made anybody that can put brackets on, or even make the brackets that you could put them on and the tooth would come to its final resting place. I say final, that's the point before it starts to just wear in over your lifetime. But let me show you this after we get in the retainer. And you've got to put a retainer on there that allows the teeth to erupt into each other. And that's what I want to stress. That is an essential part for proper finishing to me. All right, here we got everything lined up pretty good, so we're going to be taking this out. Now these two teeth, just remember, they are not fully erupted into the mouth, but watch them after we take this off and put this person in a retainer. And now we've removed that and put her in a retainer, and you watch the retainer, and this lets the teeth erupt into each other. And those teeth had a gap up there when we first put this retainer in, and then the retainer holds it from both buccal and lingual sides and allows it to erupt together. And look how the buccal root torque is good too. As it comes in, it hits and kind of angles that up. And you can't, I don't think God ever made anybody that could put brackets on or do anything to position these teeth like they're going to position themselves. This one runs down, this one comes up, this one comes up, and they work out a situation in here for this tooth, and then this works out for these two teeth here, and this for these two over here. Each tooth works its position out. And look at the 6 keys to occlusion is in here. And let's look at the center line. It's off a little bit, but not too much. And this is not the final deal, but look at it, and these cuspids will be better later on down the line here. Now that's 320 something, 87, I believe. All right. Now look at the way this 6-year molar cocked in right here. I didn't have that band on that tooth arranged so it could come down like that. This tooth had a gap up above it. I pointed, you go back and look at it if you want to. And when we took it off, then it erupted down. And it hits at a certain angle, and that puts a tilt to the root. And that gives you a better airway up here. It's just so much better if the retention will allow the teeth to erupt into each other properly. So I'd never put a wire. I say that I've done it a few times, but I just almost never put a wire across the occlusion, because you're going to hit the thing somewhere in there. So when you're wearing it, it hits it, and they move one way, you take it out, it moves back the other way. I want the teeth to erupt together and be at home with a retainer in there, and at home when the retainer's not in there. And let the teeth wear in like that. And we put bite plates and we hold the depth in there. I used to leave this on till I had the 3-to-3. Now we put the 3-to-3 behind here before we ever take it. We just take all this off at once down here. For the last time I worked in it. Now we had bands on these teeth, so they've got a little play in here, and so we trim this down so these teeth can drift forward and take up this band space, and that closes this out. Then we put a bite plate, and the lower anteriors bite into this position right here, and it'll never deepen as long as they wear that retainer. And we try to touch each tooth with this retainer wire as we go around, you see, and allow these teeth to erupt together. They wear out some in this point. Sometimes it's thicker. It's acrylic to cover this, and the teeth erupt together in there. And this, and I think that is the finishing part of the orthodontics, is done in the retention. And here it is. She's still pretty flat-faced. I was not able to get that filled out. She's got a very thin upper lip. But now look at the teeth. Now this is after a few weeks or a month or 2 or 3, something in there. See how these cuspids are fitting in here now? And you see the angle as the teeth are setting in at this angle. That's the buccal root torque. The upper teeth lap over the lower teeth properly. You don't bite your cheeks with something like this. And this is fitting together properly. And that happened in the retention. And you cannot put the shell devices over the teeth and have a coating the same thickness all the way around here and expect these teeth to erupt together with these shell things. Now, some of the cases that are done, they pay so little that it doesn't afford you to make good retainers to put in there. But you should have a good retainer, especially on the upper, and put a fixed thing on the bottom and let the teeth erupt together to get this type of occlusion when you get through. Now look at the way it is, and look at this. Now you couldn't get this 6-year molar down in here any better, I don't believe. Now this is the tooth that was up higher, and it's erupted down. It's not perfect, but it will maybe turn a little bit as it hits over here and rotate in this direction. This one is much better. This is perfect. And the teeth around in this side. So I'm pushing for people to finish the cases with retainers that just have a wire going around the retainer and the inside part. Well, this is the lower one here, and we just put a bonded 3 to 3 down here and leave it on that. But up above, have no wire crossing over the occlusion, and have the teeth erupt together, and that's the finishing part. I'll back up here a little bit, and I'm going to go ahead and close it out. I hope you got something out of this, and if you did, well, hallelujah. If you need to get in a good organization, get in the American Orthodontic Society. You can join it. It doesn't matter. You can be in Timbuktu and still join the American Orthodontic Society and get our journal and stuff. And so I'm going to call this quits. And thanks again for watching, and hope you'll subscribe to our channel now. Thank you.